Chapter 12, Caring for Patients with Mental Illness and Substance Use Disorder in General Practice Settings. Clients with mental illness historically have been misunderstood, misdiagnosed, and mistreated. So the difference is for the clinical illness, typically you are looking at a physical wound, right, or element. When you have a mental illness, it is neurochemical, neurological, genetic, sometimes influences of the environment that is causing this illness. There is a need for healthcare providers to be educated on mental illness and to appreciate the symptoms of any distressing neurological illness. Otherwise, there will remain a lack of treatment or mistreatment of psychiatric patients. Clients with mental illness die 25 years earlier than the general population. So this is due to the lack of education in reference to mental illness for healthcare providers. And 60% of those deaths are preventable or treatable. So diagnostic overshadowing, you need to know this. Diagnostic overshadowing is a phenomenon in which a person's physical symptoms are attributed to their mental illness. Clients with mental illness come to general settings for care and receive a lack of treatment and a lack of appropriate referrals. Every nurse needs education about mental illness and how they can perform competently in their nursing role. So, as I mentioned in our first class, you do not need to be a psychiatric nurse in order to deal with mental illness because we are dealing with individuals and people, and their mental health or mental illness goes along with that. You're dealing with a whole being, okay, regardless of the setting. Non psychiatric nursing settings, they must have an understanding of how depression affects the person's physical body. So, 1 out of 5 women and 1 out of 10 men during their lifetime will be depressed. And depression is a risk factor for cardiovascular disease, metabolic syndrome, diabetes, dementia, asthma, arthritis, and hyperlipidemia. So, there are a variety of screening tools that may be used to assess a person. For our mentally ill patients, a screening tool is better than using clinical judgment alone. And the screening tool is used to determine whether further assessment is necessary or intervention is necessary. Horowitz and Associates developed a screening tool that has 2 questions to determine suicide risks. The first question is, in the past, have you had thoughts about suicide? The second question is, have you ever made a suicide attempt? If the person answers yes to either of these questions, then the third question is asked. Are you having thoughts of suicide right now? Horowitz and Associates developed a 2-item nursing screen for suicide risk in a medical setting. The screen asks 2 questions. In the past, have you had any thoughts of suicide? Have you made a suicide attempt is the second question. If the person answers yes to either of these questions, the third question is asked, are you having thoughts of suicide right now? So I do want to emphasize that you need to know this. So in a medical setting, not in a mental health setting, but in a medical setting, these questions may be asked just to evaluate if the person's at risk for suicide. So these are yes, no questions. They're not open-ended questions encouraging someone to express how they feel. However, they are necessary questions, and these questions must be asked at an assessment. Okay? Because if someone answers yes and they are at risk for suicide, then we want to make sure that they are safe. Nurse managers have the responsibility to equip their nurses with the proper screening tools and typically you will follow your facility's policy in reference to screening. So, trauma, suicide risk, substance use disorder are considered prevalent, high risk priority for all patients when screening. So, these questions are typically asked in any healthcare setting, all healthcare settings. They want to make sure that the patient feels safe, that they're not thinking of harming themselves, and they evaluate whether they have an addiction to some type of substance. Screening for trauma should be conducted when the patient first enters the healthcare setting. And violence and trauma are linked to a high risk for injury, unhealthy coping, other illnesses such as arthritis, irritable bowel syndrome, chronic pain. Most individuals affected by violence are women and children. And so, if violence or some type of trauma is suspected, make sure that you are interviewing this client in a secluded place so that they can have privacy and they will feel free to share with you. Trauma in childhood is linked to significant cognitive, social, psychological, and neurobiological changes. So, trauma in childhood can contribute to physical and mental problems into adulthood and result in early death. Many people with childhood trauma are reluctant to share the critical information and they um, feel guilt and shame or fear of consequence and oftentimes will deny what occurred in their childhood. Nurses should recognize the risk for unwittingly re traumatizing a patient due to lack of awareness or lack of sensitivity to the impact of the trauma. Therefore, trauma informed care is necessary. So, you are assessing and demonstrating sensitivity to the impact of their traumatic history on the current behaviors and relationships. National attention to suicide rates within specific groups have raised awareness of the need for screening and interventions. Specific screening is especially important for groups who may not be so forthcoming with their thoughts of suicide. And these example of this includes military personnel with PTSD, older adults with depression, trauma victims. A brief screening is not enough to prevent suicide in some individuals. Defensive medicine is doing the minimum number of interventions needed to meet the letter of the law. So just to fulfill the obligation to screen, right? Depression and substance use and or chronic pain are risk factors for suicide in patients in a primary care setting. Establishing trust, a collaborative relationship, and willingness to discuss issues in various vantage points are all essential in identifying the needed level of care or referral. Individuals who use NSSIB or non suicidal self injuring behavior are more likely to attempt suicide than those who are non self injurers. It is important to care for and refer these patients to the appropriate setting. So, non suicidal self injuring behavior is typically non lethal repetitive acts that a person does, such as cutting themselves, right, to reduce the stress rather than end one's life. Patients that have psychiatric comorbidities, so they may have more than one diagnosis, psychiatric diagnosis, should be, should be referred to a psychiatric mental health care service. So they should be referred to a psychiatrist. This particular bullet is important for you to know, or a mental health nurse practitioner or mental health doctor. Um, you want to make sure they're referred to someone who specializes in mental health. Those who exhibit NSSIB in response to command hallucinations need immediate medical attention. So command hallucinations are when voices are telling them to do something. Rate of opioid abuse in the U.S. has reached epidemic levels. Opioid addiction can lead to overdose. Methamphetamine use has increased significantly, and the withdrawal from methamphetamines will increase the risk for suicide. Numerous physical and psychological consequences of long term alcohol use are well documented. Screening, brief intervention, and referral to treatment, SBIRT for short. So you need to know what this is. Screening, quickly assessing the severity of the substance use and identifies the appropriate level of treatment. B, B and I, brief intervention, focuses on an increase insight and awareness regarding the substance use and their motivation to change. R, referral to treatment, which is our T, provides those identified as needing more extensive treatment with access to specialty care. Many patients may deny the use of substances due to legal consequences. Substances during pregnancy may have a legal consequence which can deter prenatal care. Establishment of trust, clear communication about why this information is being collected and how it will be used are important first steps in the screening process. And we have ourselves a question. A nursing instructor is teaching a class about SBIRT. Which of the following terms should be excluded? A, screening. B, brief intervention. C, referral to treatment. D, transferal. I'll give you a second. You are correct. The answer is D. SBIRT stands for screening, brief intervention, and referral to treatment. Structured screenings are the first critical step in improving care. However, the nurse must know her role in a non-psychiatric setting. So if in fact she does not know how much care can be provided to a psychiatric patient in a non-psychiatric setting, there may be a delay of referrals or a lack of care. Patient-centered care involves collaboration with the patient in the referral process. So you want to empower your patient, listen to them, involve them in the decision making around their care. Patients who are at high risk for hurting themselves and are unaware that they have significant symptoms of mental illness need to be referred to a restrictive environment, even if it's against their own will. Stigmatization is an attitude of devaluing a person because of a particular characteristic or illness. It creates a barrier to effective mental illness treatment in a primary care setting, emergency room setting, med-surg unit, as well as psychiatric setting. Knowledge gaps, clinical skills, and stigma need to be addressed in non-psychiatric settings. So social distancing is an aspect of stigma that refers to the tendency for healthcare workers and others to avoid people who have mental illness or addiction. So remember I talked about doing that self-reflection, that self-evaluation, and making sure that you're not treating your patients any different, right? Hallucinations, neglect of self-care, and agitation can be challenging symptoms for some clinicians to manage. The role of the nurse in caring for a client with psychiatric and substance uses in the non-psychiatric setting include the following. Examine one's personal beliefs and attitudes about clients with mental illness and substance use disorder. So I've been saying that since our first class. Make sure you do a self-evaluation. Develop awareness of the negative impact of stigmatization. The role of the nurse continued. Identify patients with potentially high prevalence, high risk mental health issues. Utilize evidence based screening tools to identify patients needing further evaluation or referral. Provide for patient safety up to and including continuous monitoring as determined. The role of the nurse continued. Establish a working knowledge of healthcare services for referrals and collaboration, and make sure that you have the appropriate resources to refer your patient. Engage the patient throughout the assessment and referral process using a patient centered approach. And we have ourselves a question: which describes the tendency for healthcare workers to avoid people with mental illness or addiction? A. Referral. B. Social distancing. C. S-Bird. D. Diagnostic overshadowing. I'll give you a minute. You are correct. The answer is B. Social distancing. Social distancing is the tendency for healthcare workers to avoid people with mental illness or addiction.